Hi, my name's Noah Hardy. I'm going to teach you guys how to deliver a baby today. Let's get going. Alright, I'm going to teach you how a baby is formed. So right up here is called your ovary. And what is inside there is an egg. When the egg is released, it drops into the fallopian tube. Inside the fallopian tube is met by a sperm cell, and they intermingle, and then is dropped into the uterus. And there, inside the uterus, it attaches to the uterus wall, and it grows. It's gnarly. So inside the uterus, or the womb, it takes about 9 months approximately for the baby to fully develop. So let me tell you about the 3 stages of labor. The first one is the dilation of the cervix. Well, what is the cervix? It's a little tunnel from the vagina to the uterus. And it goes from like this to like this, so a baby can fit through it. Second is delivery of the infant, where the baby comes out. And the third one is the delivery of a placenta, which you'll see later, it looks like a pancake or something. So in the first stage, it's called contractions is what they're having. So what is happening is the cervix is trying to stretch itself to make the baby be able to get through there. So the first step is contractions, and they're usually lasting about 16 hours before birth. Another way you know how they're about to have a baby is when the amniotic sac breaks or there's blood everywhere. Usually their water breaks. The second stage of labor is when the baby enters the birth canal or is delivered, which is called spontaneous birth. During this second stage, the mother will usually have pressure on the rectum because the baby's coming out, and she'll think she'll have to take a dump, and so you can't let them go on the toilet because, you know, sometimes the baby comes out along with it, and yeah. So along with the end of that second stage, right before they have the baby, there's something that calls crowning. Now when you see crowning, the baby's basically coming out. What it is you see their little head right there, it's bulging out, so it's about to drop out, so that's when you know to cradle. Okay, now the third stage starts with the baby coming out, and it ends with the delivery of the placenta. When the placenta is delivered, what happens is it sticks to the urinary wall, and it takes about up to 30 minutes for it to detach from that and finally come out. And during that, the contractions are still happening, so it's kind of trying to pull the placenta out, so that's kind of how it comes out. Alrighty, so this is your OB sealed GAM standard. So this is everything you need to deliver a baby. So what it is a sterile powder-free gloves, we got those. A disposable apron, got those. Under pads, right here. White professional towel, right here. Sterile gauze sponges, gotta clean up some blood. A OB towelette. Sterile umbilical cord clamps. Sterile bulb syringe. Plastic placenta bag. That's exciting. Some little twist ties to clamp that thing. Sterile OB napkins. And a tissue drape. Okay, so how do you want to position your patient and get them prepared? So basically you want to take off all their undergarments, everything, so it's just bare skin. You can deliver the baby. You want to sit them down, put a pillow behind them to elevate their hips about 2-4 inches. Although you're taking all their clothes off, you kind of want to cover it up as much as you can, just so to be modest for them and they're not just bare naked out there. Alright, so preparing for delivery, what you want to do is you want to place a nice sterile towel under them so that when everything comes out, it's not just going on the ground. Second thing is, for your safety, you want to have gloves on. Alright, so the first step is when the baby is coming out. You see the head coming out. It's part of the crowning. And so what's going to happen is you're going to see the head start popping out. First thing you want to do is make sure that its umbilical cord is not wrapped around its head. So what you want to do is you want to just gently feel around its neck to see if there's anything tingled. If there is, you just gently pull it over. Basically, you want to support its head, and babies are mouth breathers, so when they come out, they have all that gunk that they've been inside the uterus with and all the fluids that are keeping them alive. So you're just going to take your thing and just stick it in there and suck everything out. Squirt it, suck. So second, after the head comes out, you should start to see the shoulders right there, and you just want to support this little alien, alright? Alright, so step 3 is when the baby fully comes out. And you want to handle it with care because it's going to be slippery, so if you're like, oh, you dropped your baby, that's bad because you just dropped some lady's baby and they're going to be pissed. Okay, so the 4th step is you're going to clamp the baby's umbilical cord to disconnect it from the mother. So, hold your baby. Thank you. You got to find your clamps. It's always good to be prepared. Have everything done. So what you're going to do is you're going to place the first clamp 4 fingers away from the baby. The second one, you want to clamp 2 to 4 inches away from the second one. And then what you're going to do is you're going to take your scalpel and you're going to snip it right in half. And what's going to happen is the baby's going to be its own little baby, and it's going to be breathing on its own and living off itself. So, yeah. So your baby's out, and he has all the blood and stuff on him, so you're just going to gently wipe him down, make him clean. If you didn't notice, it's a boy. So the 5th step is you're going to wait for the placenta to come out. And like I said, it kind of reminds you of a pancake or a patty or something, I don't know, but you're going to take this placenta. Some families like to eat it, some others just want to throw it in the trash, but you're just going to throw it in this bag for them. You're going to fold it real nice, make it real pretty, twist off the end, get your little twist tie, twist it, and there you go. It's like Christmas.
Does your vagina hurt? 'Cause mine does.